All right.
So it's a combination. It's pretty cool using Zoom for these conference calls and these interviews that I've been doing and going out. It'll be recorded, and here we go.
It's a brave new world.
It is. It is. So welcome everybody and our audience out there today, our viewers. This is Brad Thompson. I'm the founder of Red Key, and I'm super excited to be talking with Dr. Rahul Kapur today about COVID-19 and what's happening in his world. And gosh, welcome to the call, Rahul. How are you doing today?
I'm doing great. I'm doing great. Thanks for having me, Brad, and happy to join you and get some information out there.
Well, I love it.
Sort of getting overwhelmed with everything.
It is like information overload. I mean, I make it a practice not to watch more than an hour of news a day.
Oh my God. Going through a pandemic is bad enough, and then you got the 24/7 news cycle.
Yeah, then just chirping your ear the whole time. So, so Rahul, why don't you just share with our audience a little bit about your background, your education, where you practice, what you do, and those types of details.
So I'm in Kansas City. I've been here for 9 years. I've been a practicing physician for 12 years. I graduated from University of Kansas family medicine practice, and I've been working as a hospital doctor for 12 years. And last year I opened my health and wellness clinic, providing concierge services among various other novel depression treatments, hormone treatments, as well as some aesthetic treatments as well. So I have an independent group at the hospital. We have 14 doctors. We cover 2 hospitals. One of the hospitals is fairly large. It's about 450 beds, and the other one's about 250 beds.
Okay.
So that's my practice.
All right. Well, fantastic. Now, you shared something interesting, and I'd love to get your perspective and have you share with our viewers out there today. The number of cases is lower in the Kansas City area than maybe, relative to other major cities of its same size. Why do you think that is, and what's going on in Kansas City that might be causing that, do you think?
So, a couple of things. I jokingly tell people that our airport is so poorly built that people don't travel here. But one of the things is my sister, she lives right across the Hudson River in New York on the Jersey side. My sister and brother-in-law work in New York, and they basically, they live in these large buildings with common ventilation. They take the subways. Here, we are at home, but I have a large backyard. I'm not sharing ventilation with anyone. I drive to work in my own car. We are a very spread out city, and our international travel is not as much as it would be for these larger cities. 70% of the outbreaks, as predicted in our area, have been in nursing facilities, assisted living facilities, close quarters, and people who are already in poor health. We've been blessed in that sense that we haven't had large outbreaks here. But like I tell people, we're in the first quarter of this. We just finished the first quarter. We have 3 more quarters to go.
Wow. So let's take, first quarter being 6 weeks, maybe 7 weeks, depending on, when you start counting the heightened activity. So you think we're going to still be experiencing this in August, September?
I mean, looking back at, just to give a little background of how this whole thing started, in December, they started seeing a whole bunch of viral pneumonias in China. And that's when they first diagnosed this virus. This is literally 4.5 months ago. That's the time frame we're talking about. And then this spread like wildfire in Wuhan. And when January 23rd is when they said, stay at home. And then finally, February 1st, they went to a full lockdown. But unfortunately, by then, international travel was continuing. And the way SARS-CoV-2, which is the virus that causes COVID-19, spreads is through respiratory droplets like influenza. It doesn't travel more than 6 feet, as far as we can tell. And so the issue has been how many people have been exposed, we don't know. And so that's kind of where we are right now. Thankfully, there are a couple of positive things so far. One is that a majority of people are asymptomatic. And the second thing is children are largely spared from any severe symptoms. The outbreak we're seeing is from like 10 to 18-year-olds whose immune system are a little more developed and able to handle it. So there's a lot of positive developments. But if you look at the previous pandemics, looking back at 1918, when the Spanish flu, there's been a lot of talk about it. How it started was in the spring, just like kind of what's happening now. It was a very mild outbreak. Mm-hmm. And then in October to December is when we had a real uptick. And at that time, we didn't have international travel, but it decimated Virginia, Massachusetts, and then it came back in the spring of 1919. So there were two waves. The good news with this virus is it is each of these RNA type viruses, they do mutate, but this one hasn't mutated too much to where the body recognizes it as a new virus, which is excellent news. You may have heard about WHO recently saying that we're not sure if we develop immunity. And what they mean by that is that they don't have enough evidence to say that we're developing immunity. But based on previous viruses, previous coronaviruses, for sure, you are likely to develop some sort of immunity to this. And the reinfection rates in places like South Korea are 2%. And that's largely due to reactivation of the virus.
Yeah, it's interesting. There's just so much information out there. You don't know what to believe, and the shifting in facts from day to day about, if most of us might get exposed to it. We might even be carriers, but we're asymptomatic, as you said. We don't show any of the symptoms and just maintain a healthy lifestyle. And the reinfection rate, one day you read that you can't get it twice, and the next day you read you can get it twice. And so I think a lot of that still has to be sorted out, obviously. You mentioned influenza. I have a question about that and I want your opinion. Why is this so much more, contagious than influenza or the flu? But there's more people that have died annually with the flu than what we're seeing with COVID.
So to give you some numbers, the recent CDC numbers for the last flu season just came out, and they start from October, end of September, October to March of 2020, and the deaths they estimate is 23,000. So in that cycle, okay. So now we are, I don't know the number today, but we're inching towards 60,000 already in the United States. So the numbers, I think already it's proving out that that's not true, just based on the fact of the numbers. The other issue being influenza has been around for a long time. We've all had some exposure to it, some degree of immunity. Most of us have been vaccinated for it. Our symptoms are very much mitigated because of our previous exposures, our immunity, and the fact that we have some treatment for it. As well. And those things are not true with COVID-19 at this time. We have no vaccine, we have no effective treatments, we have some modalities that work. And so those things make it different from a regular influenza outbreak.
That's awesome insights. Thank you. Thank you for that. Let's talk about vaccines for a minute. They're working on a vaccine as we speak.
Yes.
And there's two camps. I know people that will be the first in lines to go get that vaccine and they want to protect themselves and their family. And I know other people that say, nope, I'm not going to get a vaccine for it. What do you say to those people?
So, the way I think this is going to work out is right now we are hearing these stories. And then once we see our people we know, family members we know, people in the community, our friends and family get COVID, get diagnosed, fall, see the symptomology. For now, to a person sitting in the Midwest in Kansas City, it's like, oh, it's a coastal issue. It's not really a big deal. And I understand that because they're not seeing the patients. They're not seeing it in the community. We're all going out for walks. The world hasn't ended. Or just binge watching Netflix and eating a lot from Uber Eats. That doesn't sound like a terrible thing to go through. So I get their perspective, but on the other side, I have seen someone in the hospital die from COVID, and it's a very helpless situation. We have no treatments. To have to say goodbye to their family members via an iPad. Um, it's just happened. I've just done it once right now. People in New York have had to do this multiple times a day. Just recently, 2 days ago, one of the heads at New York Presbyterian ER Hospital committed suicide.
I just saw that. I read that today. That's tragic.
And so, areas that are affected understand this. As far as I'm forgetting your original question. I got a little carried away with that.
We're talking about vaccines, I think.
Yeah, so the vaccine issue is, I think as this happens, people will understand that it is a real illness, its severity, and I think they'll be more open to the ideas of vaccines. People who are previously not getting vaccinated may take longer to get there, and I understand everyone's concerns, but I don't buy into the conspiracy theories of 5G and someone trying to microchip us and unfortunately, if New Yorker had a great article on vaccines, and back in 10th century China or India, smallpox would be these blisters, and how they would how they would vaccinate people is they would burst the blisters. These shamans take that fluid and put it in the nose of children. And that was a way to inculcate them to have their own immunity. We've been doing this in different forms long before vaccines were present. The only problem is Big Pharma has got a bad name, understandably now, and this is coming from Big Pharma. But vaccines are tough to create. I mean, our track record, it's taken 3 to 4 years for the fastest vaccine to be made. So, but the good news is, I don't know, I'm 42 years old. In my lifetime, everyone in the whole world is concentrating on this problem at this time. And so we've got the brightest minds, and I think our vaccine date will be faster, but then getting it up to scale, getting it to everybody and those kind of issues, I think we continue to educate people about the vaccines. And the more information, the more we have interactions with the healthcare community like we're having today, and we just provide information, real fact-based information, as opposed to ones with a political bent or anything of that sort. I think that helps people understand what's happening. And I completely get the person who's on the street who hasn't seen this happen and say, what is the big deal? I want to get back to work. I completely understand it. I have a business of my own. And it's going to be a financial catastrophe on many ends.
Yeah, I agree with you on that. And I think there's going to be so many new norms for us that have been created in the last 6 to 8 weeks.
Yeah.
As far as social distancing, it's going to be a while before, we shake hands again with friends and colleagues.
Right.
It's going to be a while before we give people hugs. It's going to be a long time of people wearing face masks everywhere, out and about, as we do. And my family is taking all the precautions that we simply can, staying at home, self-isolating. We're getting out for exercise and walking, as you mentioned, but we have face masks on. We wash our hands. We spray our shoes with Lysol when we come back in. We leave the shoes at the door, not in our living area. In addition to all those things, and being extremely conscious about washing hands and wearing masks, do you have any other advice for people out there?
Well, one of the things that I've noticed now is that people are living in a state of anxiety and fear with this. And that's something that suppresses your immune system. That's, if we're going to live with this for months or maybe a year or two, we've just got to change our mindset and accept some of these things and be okay with it. I think that, just understanding that it's kind of, this is what's happening and this is what I need to do. And understanding if you slip from time to time, it's okay. You don't have to freak out about, every single thing. That's one thing. The other thing is, this is a great time to get your health in line. So many people have sleep disorders, and one of the big things that happens with our immunity that's key is 8 hours of sleep is key. There's a genetic polymorphism that allows you to sleep 6 hours, and that's 1 in 100,000 people have that. You have more chances to be struck by lightning, and you ask around, my patients, getting 8 hours uninterrupted sleep is unheard of. I mean, I have an iPad on my face reading something about the end of time right before I go to sleep. And then, lights are blasting in my eyes. I'm not turning off all my devices, taking a second to catch a breath, just do some breath work, meditate, chant, whatever works for you, working on just myself, and getting with your physician, doing some sort of blood work, finding out where you are, making a plan to correct some of the harmful behaviors. And I'm guilty of it myself. I'm someone who's overly caffeinated, underslept. It's just not a good way.
You need to write yourself your own, prescription, right?
Well, they say physician heal thyself, and I'm guilty of it. So easier to preach, yes.
Oh, well, let's talk about not only your physical well-being and sleeping and taking care of your body as best you can. You shared with me that you've seen a large increase in mental concerns and mental health with your practices. So talk to our viewers a little bit about that.
So, I have a population of people with depression, anxiety that we treat. And certainly we see a lot at the other end of the hospital with who come in suicidal or drug overdose. Initially, when this started, people who were previously depressed and anxious or previously abusing drugs started getting worse. So we saw people that we normally would see in the hospitals or the clinics coming back saying, my depression's worse, my anxiety's worse. And that was understandable. But now, 6 weeks in, I'm seeing people who've never previously had any of these issues, just being at home, just knowing that the world is changing and not knowing what to do, what your role is and how to deal with it. And that is causing a significant amount of anxiety for people. I wish I had any answers. I mean, the world is in this viral fog. The future is kind of clouded, but we're alive and we take each day at a time. We're thankful to be alive. We have a lot of blessings. And so if everyone can sort of find a way to get their inner peace in that sense and take this time to recalibrate and understand that things are going to change.
Yeah, I think that's great advice. I think keeping track of gratitudes is a great way and practice to do that, not only during good times, but especially times like now. I think we're all looking internally and finding thanks in many things that we didn't even think about in the past. And that's great advice to help keep that positive thought going and clarity, and just remind ourselves of all the things that we can be thankful for. And I think it's important for our viewers out there. Keeping a gratitude journal.
Yeah, well, I have two kids, 7 and 4, and I made them start a gratitude journal, and I forced them to write that I'm thankful for my father and all the work I do. So that when my wife yells at me, I just pull it out and say, look, I have proof I do something.
Yeah. Oh, that's excellent. I love it. Well, I know time is precious for you with all that you have going on with your practice and practices and facilities. I really appreciate you jumping on and sharing with our viewers today. What's the best way for somebody to get more information, either from you if they're interested, or Facebook, or
the best way is my website, reviveandrally.com. It has all my contact information. If you message us, we do telehealth. We can order labs anywhere in the country and kind of get things worked out. And happy to get on a phone call with anyone and discuss these issues. We've had, thankfully, our patients, we've found a way to keep in touch with them through this whole time. And they're all anxious to get back and get back in the routine of things. But another thing I want to say is that I want to remind people that this is not the bubonic plague. This is not the Spanish flu pandemic. That we're going to be fine. We just have to innovate. We have to stop our reliance. All our medications are pretty much made in the Wuhan province in China and some in Italy. We have to sort of get back to being the self-resilient nation that we are, and building these factories and manufacturing back here. It's going to be painful. It's going to take them, but we're up to the task. We've done it before, and I'm positive that we're going to do it again.
I think that's great advice. Dr. Kapur, thank you so much once again for your time. It's great visiting and chatting with you today, and looking forward to speaking with you again sometime in the near future.
Absolutely, Brad. I love what you're doing with your company, so keep up the good work.
All right. Thanks so much. I appreciate it. Take care.
Thank you.
Bye-bye.